Welcome to the Clean Classrooms for Carolina Kids Asbestos Section Overview. This program is a partnership between RTI International and the North Carolina Department of Health and Human Services, along with the North Carolina Department of Public Instruction as a liaison. To begin, the overall goal of this section of the program is to identify and eliminate exposure to asbestos hazards at public schools and childcare facilities. For facilities that require an inspection, we will coordinate an on-site visit by an accredited asbestos professional. If hazards are identified, facilities can request reimbursement from NCDHHS if they decide to perform mitigation activities. We encourage you to also be communicating with your community regarding your progress through the program. We provide communication resources on our website that makes it easy to update staff, parents, caregivers, and students on the program. We're going to quickly overview the asbestos section steps. The first step is attending the pre-enrollment webinar to learn about the Clean Classrooms for Carolina Kids program. And the step is completed. Following this training video, the primary contact will be ready to complete the enrollment survey and upload necessary documents. Our team will review the enrollment survey responses to determine next steps for your facility. If we determine that an asbestos on-site visit is needed, our program will then assign an accredited asbestos professional for your facility. The accredited asbestos professional will schedule the visit with your facility and will then conduct their on-site visit, including sampling if needed. Any samples collected will be analyzed at an accredited laboratory. Once results and recommended next steps are available, you will be notified by email that they are ready for your review. Facility administration should notify parents, staff, and students of the results using resources provided by our program. If any asbestos hazards are identified, the facility must restrict access to those areas or choose to mitigate based on the recommended response actions provided by the accredited asbestos professional. If any mitigation activities are conducted, facilities can request reimbursement from the North Carolina Department of Health and Human Services. Now let's talk more about the who, what, why, when, where, and how of the asbestos section of the program. Your facility should designate a primary contact to complete the survey and be the main point of contact for the asbestos section of the program. Additional individuals can help to complete the enrollment survey if needed. In order to access the enrollment survey, you will need to complete this training. So who should be the primary contact? The primary contact should be familiar with any asbestos inspections that have already been conducted at your facility. They should be familiar with the layout of all buildings at the facility. And additionally, if asbestos hazards are identified at your facility, the primary contact should be able to oversee the efforts to restrict access to or mitigate these hazards. To complete the asbestos section enrollment survey, the primary contact will need information on your facility, such as when it was built, student demographics, previous inspection details, any concerns about exposure, past and planned building renovations, and exemption documentation, if applicable. Exemption documentation must be submitted to RTI for a facility to be eligible for an exemption from an on-site inspection. Facilities that were built after 1988 may be exempt if they provide a property tax record that displays the year the building or buildings were built. Facilities may also be exempt if they provide documentation of an asbestos inspection conducted within the past 3 years. Additional documentation may be requested to verify the prior inspection meets the rule requirements and any identified hazards have been addressed. It is important that documentation is submitted to the program because this is a state-mandated effort to digitize lead and asbestos records and make them easily accessible in a public document repository. If your facility is not exempt, an on-site visit will be required. You will be notified when an accredited asbestos professional is assigned to your facility. The professional will contact your facility soon after being assigned to schedule the visit at a day and time that works for everyone. We estimate that the on-site visit is expected to take 1 to 3 days, depending on the facility size. During the on-site visit, the accredited asbestos professional may collect samples of building materials that they suspect may contain asbestos throughout your facility, such as ceiling tiles, floor tiles, insulation, and fireproofing material. If your facility has already been inspected for asbestos, but it was determined that an on-site visit was still needed, the professional may also resample building materials that are damaged and present a hazard. In general, asbestos sampling is non-destructive, but it may cause minor damage to sampled materials. To prepare for the on-site visit, the primary contact should plan to meet the accredited asbestos professional when they arrive to give them access to the facility. Floor plans should also be available for the professional to review while on-site. And finally, your facility can remain open during the on-site visit, but local areas may need to be restricted at the discretion of the professional during sampling. Thank you for helping us identify and eliminate lead and asbestos hazards where North Carolina children learn and play. You may now continue to the Asbestos Enrollment Survey to complete the questions and upload any applicable documentation. If you have any questions, please contact our team using the QR code or website link on the slides. You can also call or text us at 1-855-997-2864 or visit our FAQ page. The Clean Classrooms for Carolina Kids team is here to help you throughout this entire program. Thank you.